One of the main barriers that keeps people from considering weight loss surgery is the fear of complications. These are surgeries, and incisions will be made and procedures will be performed. Now, weight loss surgery has come a long way in terms of its safety. In the last 5 years, we can confidently say that weight loss surgery is about as safe as having your gallbladder out or having an elective hip replacement. So it's not taking your life into your own hands. It's having a procedure to improve your medical condition. That being said, there are things that can occur. With any surgery, there can be bleeding, and there can be infections inside the abdomen or in the wounds. These events occur far less than 1% of the time, but they do occur. Bleeding is typically something we will identify while you're in the hospital and treat it if needed. We go to great lengths to prevent bleeding. Infections typically will present later, and sometimes the patient will be at home and their wound will get red or tender, and we'll see that person in the office. Most of the time, wound issues can be handled as an outpatient in the office without the need to go to the hospital. There are other types of complications that are not specific to the operation that you could have if you had any operation. Heart problems, exacerbation of pre-existing lung conditions, blood clots in the legs, or worsening of kidney function. We're going to do a good job of trying to identify those risk factors before your operation. And if you see specialists, have you see those specialists before your surgery so those diseases are maximally managed before we undergo an operation. When you look at all the patients in our practice that have weight loss surgery, less than 5% of them are going to have a problem that requires they go back to the hospital. By far, the most common thing that does occur is problems with hydration and post-operative nausea. We're operating on the stomach. Everybody is going to sense that differently, and for some people, that's going to give them an upset stomach. They might struggle to get the liquids they need in those first 2 to 3 weeks. A small percentage of people will need to have fluids delivered by the vein. The majority of the time, we can achieve that as an outpatient, either at an infusion center or urgent care. A small percentage, and actually the majority of the people who do get readmitted for dehydration. They spend one night getting their symptoms treated and getting rehydrated, and they go home. Often people will ask, why do I have to take vitamins? I'm going to be eating food. And that's true, you will be eating food, but for the first 9 months to a year, you're going to be eating less food than you typically have been eating. When you're eating only 2 to 3 ounces at mealtime, it's impossible to get all the appropriate vitamins and minerals in that small amount of food. Your body has probably at least a year's worth of extra calories stored on it. So calories are not the issue when you're eating after your operation. It's certain vitamins and minerals. And so we have to supplement those with vitamin supplements so that you lose your weight safely. The other reason people need to take vitamins is the food is not going to go down the normal way in the case of gastric bypass. And in the case of gastric sleeve, a part of the stomach has been removed. That part makes certain factors that allow you to absorb vitamins in a normal manner. You can still absorb vitamins. You just need to take an extra amount so your body is getting enough of them. And that's why vitamin therapy is required after all of our operations as a lifelong supplement.